Today, I would like to talk about priming an insulin pen. You want to first look at your EMR to make sure what order is ordered and that it is the correct type of insulin for your doctor's order. You want to look to make sure that the expiration date is appropriate. Next, you're going to take your lid off of your pen and you want to look to see, is it a clear or cloudy insulin? If your insulin is a cloudy insulin, you want to roll the pen between your hand 10 times to properly mix it, and then you want to invert the pen 10 times as well to ensure that the insulin is properly mixed. Next, we are going to take our alcohol swab and I'm going to scrub the hub for 15 seconds. Without touching the area that I just cleaned, I'm going to take the cap off our insulin needle. Again, you can see this is a clean area, so I do not want to touch it. I'm going to directly insert it and twist it until I meet a little resistance. You don't have to twist too much because then you can damage the insulin pen. I'm going to leave the cap on the end until I'm ready to actually inject. Next, I want to prime the needle, so I'm going to go to my dial and I'm going to dial till I get to 2 units. Then I'm going to press the plunger to prime the needle, and I can actually see a drop of insulin on the end of the needle. It may be difficult to see with the video. If you do not see that drop of insulin, you can repeat the steps by dialing again to 2 and compressing the plunger. And you can do that up to 6 times before you actually need to get a different pen because it may be have a malfunction. So I like to leave the cap on while I'm prepping the patient for the insulin injection, but since I took it off, I'm going to leave it in my hand. I'm going to prep the patient's skin. Allow that to properly dry. I've already checked the order and I know this patient is going to get 6 units of insulin. I'm going to have another nurse check this insulin order with me as well. So I'm going to have my other nurse check with the physician's order so that the patient knows the insulin amount they're going to get. So now that that has been double checked, my skin area is dry, I'm going to hang on to the area that I want to inject at. I'm going to compress the pen until I see that the black line is even with this white cap, and then I'm going to compress the plunger of the pen, and I'm going to hold that for 10 seconds to ensure that all of the medication has gotten into the patient's skin. 8, 9, 10. So I'm going to release and then release the patient, and then the cap, as soon as you let go of that pressure, the cap is going to automatically retract over the needle so that you're not at risk of getting stuck with the needle. Immediately you want to take this to your sharps container and twist off the needle portion from the pen and only discard the needle portion, not the entire pen, into the sharps container. Once you've thrown that away, you can put your cap back on your insulin pen and replace it into the patient's med drawer. You will be wearing gloves during the procedure, so you can wash your hands before and after.